Hello and welcome to 18WJTS Inform. I'm your host, Bill Potter, and today we're going to talk about mental health, which is really starting to take more awareness in our minds. And joining us in the studio is Kara Glendening. Kara is a licensed clinical social worker.
Correct.
And you're with Memorial Hospital and Healthcare Center.
Correct.
Kara, welcome to the show.
Thank you, Bill.
Just recently, I think mental health is starting to get the recognition as a real issue in our communities and in our nation, more so than it ever has been in the past. But we always, when we live in small communities, we think closed, oh, it really doesn't happen in our area. We know this happens in these big cities, or we know this happens in other states or other areas, but not in our area. Is mental health a concern in Du Bois County?
Absolutely, Bill. In 2016, the Du Bois County Public Health Partnership launched a needs assessment in our community, and mental health was amongst the top items that people felt like we needed some more education and awareness in our community.
And that's exactly why we want you on the show. But I'm going to ask you about what's mental health? When we say mental health, it's easy to use those words, but what does that mean?
Your mental well-being, just like your physical well-being. We talk a lot in the world of mental health about how our mental health is just as important as our physical well-being. And so when we talk about our mental health, we're talking about our thoughts, our feelings, and how those things impact our day-to-day.
In the past, mental health was always hidden or spoken about quietly, not so much anymore. Is that a good or a bad thing?
Oh, it's absolutely great that we try to raise more awareness and provide some education to everyone in our community about what mental health is, because we all have the opportunity to be supportive or to be a resource for people who are struggling with mental health. People amongst us every day, just like you and I, Bill, out in our day-to-day, run across someone who may be struggling with a mental health issue or crisis. So that increased awareness and education is key in a healthy community.
Which is another thing you're involved in, which is mental health first aid. What is that?
Mental health first aid is kind of like CPR when we talk about our physical health. We learn tools of how we can help people that are among us every day. And so like CPR helps us in a physical aspect, mental health first aid helps us recognize signs, symptoms of mental health issues that people may be experiencing. And we came up with, the National Council came up with a very structured way of how we can assist folks. So it kind of gives people an idea of how to proceed when you're in those situations. I truly believe, Bill, that people want to help, but we don't always know how to help. And so mental health first aid is that training that teaches those tools and gives people those resources of how to help.
So mental health first aid is a training.
Correct.
That is a class that is held with instructors like you.
Correct.
For different times throughout the year. We don't want to go through all the times here because it changes every other month or year to year. How can somebody find out when the next mental health training is for Du Bois County?
There's a couple ways, Bill. Mental Health First Aid has a national website which is loaded with great information. It also has a section where people can search for classes near them. So if you go to www.mentalhealthfirstaid.org, there is a section where people can search for upcoming courses. And so then they can search for the courses available here in Jasper. And there's 4 of us that do the adult training, and that's myself, Krista Linetti, Amy Dilger, and Kim Dietz. And so we are listed as the instructors for the courses that we provide through the Du Bois County Public Health Partnership.
If somebody would like to commit to one of these trainings, what sort of commitment are they making?
The courses are 8 hours. It's an 8-hour training, and we do those in one day. Sometimes we'll offer a 2-day option, but right now we're doing mostly 1-day training. So it's an 8-hour training where people come and learn. We do lots of interactive activities for those who want to participate. We don't force anyone to participate, but it's a great training of 8 hours.
Now, I assume that a lot of other places are very expensive, but Du Bois County is not.
You're right, Bill. This course can cost up to $195 in some places. We charge $35 per participant. That includes a manual that is a great resource for outside of the training. It is a really great resource. And we also provide lunch. So for $35, it's a great package.
Really, that is.
It is.
If I would go through the course, am I certified?
Absolutely. So then the national organization gives certification for those who take the 8-hour course. And then every so many years you can do an online refresher to keep that certification active.
If I would go through the course, am I taught how to recognize mental health disorders, which would be like depression, or is it like suicidal thoughts, or bipolar? Yes, because there's so much.
Let's talk about the different modules, Bill. So there's an adult module and a youth module. And in the adult training, we're teaching adults how to interact with other adults, okay? In the youth model, we're teaching adults how to interact with youth. So there's two different types of training that we offer. The youth trainers include myself, Lisa Flamian, and Heather Goodhue. So we have different trainers for the different models. So in the different courses, we teach in a different way, but basically you're learning how to recognize the signs and symptoms, not learning how to diagnose, not learning how to be a clinician, but how can you in your day-to-day recognize the signs and symptoms of concern? So we certainly talk about depression, anxiety, suicidal thinking, self-injurious behaviors. We cover a wide variety of topics in the 8 hours.
Well, I'm glad you brought that up, because I was thinking, well, okay, so I take this course, then am I responsible to help this person? No, it's just really mostly recognizing and then telling you the next step. Because you're not treating them. You're not taking, it's not your responsibility. You just simply are looking for those signs.
Right. You're kind of providing that aid until more appropriate help can arrive, or until the person can get to the next level of care that they need.
Okay.
So it's learning how to ask those questions once you recognize the signs and symptoms. Knowing resources, what's out there for folks. Where can I suggest that they turn? Those types of things.
Who should take your courses?
Anyone, Bill. Anyone who interacts with humans. This course is built in a way that it is appropriate for community members, volunteers, professionals, people in manufacturing, human resources. We've done a specific law enforcement training here in our community. We had an excellent turnout from our law enforcement folks. The adult trainers, we have a dual certification, so we're also trained to teach public safety module, which includes fire, EMS, all of our public safety workers. So we have offered those specific type courses, but most of our courses are open to community members. The Du Bois County Community Foundation has been really good to us in helping support us as well, helping support non-for-profit agencies who want to send people to our training. Supporting their registration fee and such. So we have a lot of community support, which is really exciting for us. We appreciate that greatly.
Even at $35, that is really, and to be able to keep the book, that will help you. And then I guess it gives you confidence, because you probably avoid situations because you don't know, but this will help you to know.
That's correct, Bill. Like I said earlier, I truly believe there's a lot of people amongst us in our community who want to help. But mental health didn't get a lot of attention for a lot of years, so a lot of people just don't know how to help, what the next steps are. So learning those resources, learning some of those initial steps is so helpful in allowing people to help.
So the most important thing is knowing, and then that helps you to get things going and get somebody some help that they may need. But we always avoid that situation. But this is your way to jump right in.
Right.
And these courses, again, are 8 hours long.
Correct.
With lunch for $35, but you have different courses throughout the year.
That's
Generally
correct.
about 4 or 5 of them, I would imagine you have. Is that right?
Yes, yeah.
And the best way, again, to find out if there's a class, or what if somebody's not from Du Bois County?
We welcome anyone to our class. So while we are supported by the Du Bois County Public Health Partnership, we don't turn anyone away. So people in surrounding counties, we've had someone travel from Kentucky to come to our class, Bill. So we accept anyone. We will also look at doing group-specific training. So if you're part of an organization and you want a training just for your group, we'll look at accommodating that for you.
Okay. Or again, I guess if you go to that and you type in Du Bois County or Jasper, the website again is mental health
mentalhealthfirstaid.org.
Okay, mental health first aid, and the word first spelled out.
Correct.
Aid.org.
Correct.
And you can type in Jasper, but let's say you're viewing this and you live in Washington. You could type in Washington. You might find a class that's near you there.
Correct.
Too.
Yes, that's correct.
Anything else that you'd like to add? I mean, this is such a big topic. It's
is,
really hard
though.
to cover everything, but the first thing is just to get people to attend the classes.
That's right. I mean, and just thinking about how beneficial this course is to anyone in the community. Like I said, if you interact with people, this course is appropriate for you. Parents, teachers, coaches, supervisors in factories, office buildings, HR, really anybody who wants to be able to help. And just by taking this course, Bill doesn't commit anyone to helping. You learn the skills, you learn the tools, but you can do without what you want. You can help as much or as little as you'd like.
We all know the importance of taking CPR courses.
Right.
But we often don't think of mental health until recently, because I don't think that's been on our minds or necessarily been available, this sort of training. But now it is.
Right.
And how long has these trainings been going on? A couple of years.
We started in 2017 with our, to be an instructor, we took a very long course. And so we completed that in 2017, and we've been offering the courses since that time. We've trained over 250 people, in our local community, and then have done some group trainings as well. So we're really getting out there and feel very excited about this opportunity and the support we've had from the community in conducting these trainings.
Well, Kara, thank you very much for coming in.
You're welcome.
Pleasure
Thanks,
talking
Bill.
with you and learning more about mental health and our responsibility in a way to find out more.
Absolutely.
By taking the mental health first aid trainings that go on. There's probably one starting soon or maybe in a month or two that you might be interested in. Please make sure that you get signed up, because you need people participating.
Absolutely.
How many people are in the class?
The maximum number of participants we allow is 25, and that's so we can have a good course and everybody be able to get what they need out of that course.
Okay. Mentalhealthfirstaid.org is where to go to find out about that, or I'm sure they could probably call you at Memorial Hospital and get more information.
Or we have a Facebook page, Du Bois County Mental Health First Aid is our Facebook page, so you can like that page, and we keep that updated with upcoming trainings. And then we do have an email. It's mhfa.duboiscounty@gmail.com. So that stands for Mental Health First Aid at duboiscounty@gmail.com.
Perfect. Kara, thank you very much for coming in.
You're welcome, Bill.
It's been a
Thank
pleasure
you.
talking with you. Thank you for watching 18 WJTS. We are local people watching local people.